When I go to the doctors, I want to get the best possible consultation and for their judgment to be sound. And so I feel that anyone at work, if they're in good health, both physical and mental, then they can do the job to the best of their ability. It is a high pressure job, so their mental health is very important, and it must be quite difficult to deal with such a challenging role. And also they're under such a lot of time pressures now.
We see more and more locums taking roles through either ill health or doctors on leave or absence. Then there's not a continuity of patient care. That again can be a disadvantage. Anybody within the medical fields, if they're feeling in good health and spirits themselves, I think they're also more likely to listen. So I think it's win-win all round.
I think the first main reason for me is that they're human beings, first and foremost. And so I would just want them to be a well person and not struggling. And if they were struggling, I'd want them to be working in an environment where they would feel really able to talk about that and share that and get support. I think it's really important if we want healthy people and a healthy public, then I think we also need a healthy workforce as well. So therefore I think there's just a general principle of people being able to work in their job well and feel well in their job. And if they can't, then I think that's going to they're not going to model healthy behaviours for other people either.
It's very important to me that my doctor is fit and healthy in every aspect. And then I'd want to know that during their medical training, that they were being looked after, because I think that's important in the way that they develop as medical people. There have been some suicides of young doctors as a result of mental health difficulties. And obviously it's really important that during their very rigorous 2 years as young hospital doctors, they are looked after effectively.
And I'd like to think that, like myself, if they've got a mental health problem or some other problem, that there's somewhere that they can go, even just to talk about it or even express it to somebody without it affecting their career.
It's important to remember that doctors are people too, they're not robots. I remember once waiting in the waiting room, he was running late, and when I got in there, I said to him, "Are you all right?" And he said, "Well, actually, no, I'm not. I've just had a patient before you actually have a heart attack. I've had to call an ambulance, and actually I could really do with a few more minutes." And I said, "No problem," because I could see he was like super stressed. Where is their encouragement to talk about their mental well-being? They talk about health when they're doing all their training, but I think much more emphasis needs to be given on the training for the mental well-being, not just like the patients you see, but their own personal being. When they get to 50, they've had 30 years of all that immense pressure, and I do know that doctors are leaving the profession a lot earlier because of stress.
Something really needs to be done within the health service and within research, so that our doctors and any person in the health industry is protected, and they're not, mental health is not looked down upon.